My name is Sarah Duffy. Today I'm going to be discussing the importance of CPR. This past year, I have recently become CPR certified, and I even helped teach a class at the University of Louisville to a small group of students. Heart disease is the #1 leading cause of death in the United States. Because of this, and because so many cardiac arrests will happen inside of people's homes, it is important for everyone, and not just medical professionals, to know CPR. CPR stands for cardiopulmonary resuscitation, which basically means to correct or bring the heart and lungs back to an active state. CPR is the emergency procedure that helps save a person's life when their breathing or heart stops. The purpose of CPR is to keep the blood flowing to the body while the heart is unable to. When a person's heart has stopped beating, that means they have gone into cardiac arrest and the heart is no longer pumping blood to the rest of the body. It is important that the heart is to remain pumping because that is how oxygen gets throughout the body, keeping it and its organs alive. Brain and organ damage can occur within minutes after they stop getting oxygen. However, if CPR is given within the first 2 minutes, the chances of survival double. Now, medical professionals have created steps in order to give proper care to the victims and also protect the person giving CPR. The first thing you want to do is, if you see someone that might need CPR, is to check your surroundings. You want to make sure that the environment around is safe for you to get into and that you won't come into any harm while giving CPR. Once you've made sure that this is safe, you want to go up to the person and you want to see if they are responsive. Now, when you go up to them, you want to tap on their shoulders and be like, "Are you okay? Are you okay?" Once you have done that and they haven't moved and they haven't said anything, this means they are unresponsive. The next thing you want to do is, if you are in a large group, is you need to call 911 and get the AED. Now, they need CPR as soon as possible, so before you begin, you will point out one specific person to call 911 and one specific person to get the AED. The AED is a machine that you strap onto the person with 2 pads, and it'll tell you if their heart is beating, and if not, it'll send electric shocks to it. It'll give you step-by-step instruction on how to work it. The next thing you want to do is you want to check for the breathing and pulse. Checking for breathing, you are able to look up and down the person, and if you see their chest inflate and decompress, that means they are breathing. To check the pulse, you want to use the carotid arteries, which are right here on the neck. You want to take your 2 fingers, make sure not to use your thumb because you will feel your own heartbeat through your thumb, and put it on their neck. It should only take a few minutes, but it's easy to tell whether they have a heartbeat in their breathing. If they're not breathing and they don't have a heartbeat, you want to begin compressions and rescue breaths. For the adult, you will do 30 compressions to 2 breaths, and you're going to continue this until a medical emergency services arrive or the A&D gets there and tells you to stop CPR so it can send shocks to their body. Now, they've created an acronym called CAB to help people remember how to do CPR. C stands for compressions, A is for airway, and B is for breathing. When giving CPR to the adult, you want to do 30 compressions to 2 breaths. When doing compressions, you want to put your hands together and you want to keep your arms straight at all times so you're putting all your pressure on their chest. You're only going to go about 2 inches in to their chest and then lift up. And when you do, you want to see their chest recoil before you push down again. The second step is their airway. Before you give their rescue breath, you want to make sure their airway is open so you're actually getting air to their lungs. When you do this, you will take their chin and tilt it slightly so their esophagus is straight. You will pinch their nose and begin giving the rescue breaths, and then give 2 breaths. For children, you often want to give 15 compressions to 2 breaths. Since they are kids, there's less room, the blood has to go to less places, so it's easier to get the blood there with the 15 compressions, and they want more oxygen to get to the brain because it is such smaller. When giving CPR to babies, you don't have to pinch their nose. You will put your mouth over their mouth and their nose since their face is so small. Even if you don't want to put your mouth on someone, just giving the chest compressions will increase their chances of survival. Learning CPR can be the difference between someone's life and death and save anyone's life. CPR is properly given increases the chances of survival and recovery in someone that has undergone cardiac arrest. And it is important that everyone learns CPR.